Therapists, there is a whole constellation of things that may be impacting the way our clients think, feel, and behave, at least as much as the psychological or relational factors that they come in wanting our help with. And it is our responsibility as therapists to understand what these other influences are so that we can manage them effectively. These extend to things like the state of our client's gut microbiome, or how their media landscape is impacting their stress response, which in turn can cascade into things like hormonal surges, brain inflammation. It gets complex. And that's why I'm so glad you're here with me today on Love, Happiness, and Success for Therapists. This is the space where we talk about our evolving profession and what it really takes for us to thrive in it. And today is a very special day because we are speaking with our colleague, Dr. Tatyana El-Kour. Dr. Tatyana has a fascinating background. She is a nutritionist who became a psychologist who now specializes in media psychology and is here today to talk with us about how these three things can work together to create a positive upward spiral for our clients or a downward spiral that we need to understand completely in order to be able to intervene effectively. So Dr. Tatyana, thank you so much for being here with me today.
Hello, Dr. Lisa. It's a pleasure to be here. Thank you for having me.
So for a therapist listening to this, what are some of the strategies that you recommend when you work with clients? So say someone is coming in because they're feeling anxious and they would like to feel more peaceful. And I'm guessing that your job as their therapist might be to help map out all of these different pieces and how they impact each other in that constellation. So you have a client walk into your office saying, I'm anxious. Where do you begin helping them unravel psychology versus physiology versus the impact of media, or the way that these three things are conspiring with each other to impact the mind, mood, and behavior of your client?
In that assessment, you look more into food choices shaping the gut microbiome, but you also look at blood sugar stability and also neurotransmitter availability. And the mechanisms I seek is more, is the person having enough of the protective food, or more of the ultra processed food, like foods that are high in fat, high in sugars, and refined sugars that can cause rapid glucose, spikes and crashes. It activates your immune system and causing more irritability and cravings. So I want to understand that user journey and pathway from the plate journey. So eating patterns are not just nutritional, but psychological. So even for dietitians and for psychologists, it's good to know that patients may use food as an emotion regulation, but professionals should look at when and why patients eat, not just what they eat. And so beyond the plate, we move more into physiology, which is what the body does. So I look at that. The role would be like, how is the stress level, the sleep, and the immune activity kind of determine whether the gut-brain axis, supports resilience or vulnerability. And then we look at kind of the mechanisms. We take a deep dive into their stress response, the sleep disruption, or even any interoception. If they have any low vagus tone, the vagal nerves, if they are attuned to it or not, it's blurring their body signals. They're confusing anxiety with hunger, or they're feeling fullness with discomfort. As I mentioned in the earlier story about the patient, like, I don't know if I am anxious or I'm hungry when I get up in the morning and I'm scrolling. So that's one key example of the physiology piece. And so, with sleep disruption, I look at the poor sleep lowers your microbial diversity, and it reduces the vagal tone, increases your cortisol. So, and it worsens your food choices as a result, and then it influences your mood kind of the next day. So we go through that piece and also through the piece of the stress response, if I could look into how it is manifested. So professionals, to simplify this kind of phase is professionals should view mood states like irritability or rigid thinking, not only as a psychological, but also as inflammatory brain states. And so that also, so that's the part of the physiology. So the plate is tackled, the physiology is tackled, and then we're left with the platform. And that's where I look into media use and AI algorithms. They amplify the emotional states and shape both stress and eating behavior. So we take a deep dive into the media use, how anxiety leads to anxious content, whether sadness leads to comfort content or boredom or stimulation, you name it. And then the algorithmic enforcement too. So how AI learns from your micro poses and feeds back more of the same. Looking into, for example, dieting cues, indulgent food reels, or stressful news. And then what happens biologically? So the echo, exposure to stress, your body comparison content, you get more stressed, hormonal level is affected, your gut permeability is increasing, and then it intensifies your craving. So the clinical insight here is clearly that professionals should consider the patient's digital diet alongside their food diet. So I would ask, in a simple term, how do you feel after scrolling? I like to explain this both to my, to my patients and also to my fellow clinicians as the 3Ps, plate, physiology, and platform. What we eat, what our body does under stress, and then what and what we scroll is not separate. So they constantly reinforce each other. And if we want to break the loop, we need to place a circuit breaker in all the three areas. And so we start looking into where are our circuit breakers. So as I mentioned, in terms of the plate, can we get more of the fiber, less of the ultra processed? In terms of the media, can we look into the media hygiene? Can we look into how you feed your content better or influence the algorithm or learn about the algorithmic influence? And then for your physiology, let's look at how you feel after you introduce some of those changes and then how it's kind of making the changes in your body. And this will be reflected in, of course, biochemically in your blood tests, but also how you physically feel that.
Yeah. Wow. Thank you so much for breaking it down. Just having, it's good. And even just hearing you talk through your process a little bit more in a more structured way, it is even starting to feel more manageable to me about how you would assess for these additional dimensions than I think most therapists are really trained how to. That's so valid. And that is why I am so thrilled, by the way, that you have so kindly accepted my invitation to come in and do a free CEU training for therapists where you'll be doing a deeper dive into these ideas, hopefully sharing some of your assessment questions, resources, things to consider, ideas about things that a therapist and any basic therapist could advise, like, hey, more fermented foods, maybe take a probiotic, like we got that, versus when to refer to maybe a dietitian or a nutritionist. And so I can't wait to spend more time with you. And we're getting that planned. You guys listening, it'll be early 2026, and we'll be sending out invitations for this. If you are not yet on my newsletter, please come join my newsletter. Come to growingself.com/therapists to sign up so that you can stay up to date on this and other free CEU trainings that we have coming down the pipeline. But Dr. Tatyana, I'm so excited for this one because I think as you're talking, what is coming up for me is that with clients, we just need to be adding on different areas of assessment to our process in order to get a clear picture rather than jumping to conclusions about the singular thing that it is. And I think that a vulnerability for all therapists, it's like if we are holding a hammer, everything looks like a nail, right? Like if you're a couples therapist like me, it's always a relational issue. If you're a trauma-focused therapist, we go into trauma or attachment, whatever. But what you're saying is like step step back and take your time, that there are a number of different dimensions that we need to be assessing thoughtfully, and that from that process, a clear picture begins to emerge. And then we can start thinking about interventions to just manage things, even in simple ways, on each of these axes rather than one. Did I say that right?
Absolutely. Absolutely.
Yeah.
And it's in one simple example, some psychologists resort to giving like psychobiotics, so I'm going to give you a probiotic. If you're feeling that way, the solution would be just giving you a probiotic. But even when you give the patients a probiotic, you will notice that the improvement has not been as great, because it depends on the type of the microbiome, how they're interacting, how is their diet, and how is they interact with the platform. So there is not one thing that would solve all the issues. Sometimes it is simple steps at various levels that can really make the difference. And I think you've already nailed it.
Because, I mean, you need to be managing different things. Because, like, even what you were saying, how stress, and on one vertical, I mean, being exposed to stressful messages through a platform or something in the news can impact your hormonal state that changes the way that your intestines work, and all of a sudden you have brain inflammation. Like, that's one thing. But I'm also thinking about getting into a conflict with your partner or with your kid, and how that changes your physiology. Or, what I think is also under recognized, the stress that we deal with at work, either stressful work relationships or unrealistic workloads, and how that really impacts our physiology. And so I think one of the big takeaways here is just developing a thoughtful assessment process where you're looking for all the sources of stress, but not just thinking about those in a psychological way, right? Let's go into cognitive behavioral solutions versus what is the impact on this person's microbiome and inflammation, and how is that part of this picture? And it might be a lagging indicator of stress or a cause. I mean, that's when things get so interesting. No.
Absolutely. And you don't have to know it, you don't have to be Dr. Know-it-all, This is where collaborative efforts, multidisciplinary approaches are also needed. But as you appreciate that, people will feel more connected to you as a therapist, because you relate to their ecosystem. Yeah. And now, people are inseparable from their phones or from any gadget. And so it's part and parcel of how they behave around things. And they also are completely out of touch of what's internally going on. And what you see is a manifestation. It's the relationship anxiety or the issue psychologically, which in and of itself is also something. It has its own, of course, depth and breadth to it as well.
Many times, and again, speaking as a relationship counselor, if somebody is feeling anxious about something and doesn't really quite know why, and like if your gut microbiome is the source of where this is coming from, you're not going to have insight into that, right? And so what people tend to do is create a story. They figure out a why. And so I often see people attributing the way they feel to something that their partner is doing or not doing. Like they almost find a reason, and not to say that there aren't relationship stressors. I mean, that's true everywhere, but they're missing a big chunk of the information, that it's actually the engine driving this is not in their relationship. It's actually in their bodies or in their media or in their careers. And so I think that we're talking about helping clients like take a step back. Because I mean, people get divorced over stuff like that.
Yeah. Absolutely.
Yeah, it's crazy.
And this is exactly where, if I want to leave everyone today with something, it's this, our gut, our brain, and even our media feeds are in constant conversation. So where we put what we put on our plate, how our physiology responds to stress, and what platforms we scroll all reinforce one another. And that loop can spiral downward, leading to cravings, inflammation, rigid thinking, low mood, anxiety, relationship disorders, or it can spiral upward towards stability, resilience, and even health. So as practitioners, whether we're psychologists or even dietitians, our role is not to treat food or stress or media in isolation. We need to see the full system. So a small shift of the three can really, as I've mentioned, adding fiber, changing some of your, protein to your breakfast, practicing vagal breathing, or, curating a digital feed can act as a circuit breaker. And this, alongside your therapeutic approach, might be a game changer for your clients.
Yes, absolutely. Well, before letting you go, I would love to ask you to get a little bit more detailed. And of course, we will be going into all of these in much more depth during a proper training that you'll be hosting with Growing Self here coming up. And I'm so excited. But I mean, I'm curious to hear your thoughts about simple, ethical, and also scope appropriate ways that therapists could incorporate different strategies or suggestions into therapy without overstepping and really like getting into territory that would be better served by the right type of professional. But I mean, you mentioned a couple of things related to gut-related mental health struggles and how to shut down that circuit breaker. And I heard you say, add some protein to your breakfast, higher fiber foods. I mean, are there any other things like that are anybody can do that are relatively easy, they're safe, but that can actually have an impact on slowing this whole thing down?
Yeah, I mean, so the plate physiology platform fits into everyone. So with the plate, we look at practical foods. So definitely you need high fiber foods. So introducing oats, ensuring that you have the plant-based proteins, or even some of the prebiotic or probiotic content might help. There are various forms and shapes and approaches to that. But the goal is to feed the microbiome that produces short chain fatty acids and maintain the barrier integrity and reduce inflammation. So you can give simple tips on that and then also refer to some resources. On the physiology piece, stress management is key. So stress management is one. The other piece is the vagal breathing and sleep hygiene. So introducing simple breathing techniques where you simply hold your breath, you take a deep breath and then you hold it, can actually influence the parasympathetic nervous system. And so your vagal nerve will be at ease. The connection between the gut and the brain is actually governed by the vagal nerve. So as you breathe, you relax this connection. So those will not fire up immediately to the brain, and it will not fire up immediately to your immune. So just the simple act of breathing, taking a deep breath, holding it, and then releasing it slowly can actually bring in a level of comfort. It can calm your cortisol, restore the barrier in the gut, and also support the release of serotonin. And so stress management, vagal breathing, and also sleep hygiene are critical when it comes to the physiology piece. In the platform, we look, instead of the sleep hygiene, we look at the feed hygiene. What are you being fed in the digital diet? And so this is one piece. You have to really, so sometimes it's just awareness of those can trigger a shift in the behavior of your patients or clients. And the other piece is, how can you work on strategies to mute harmful content, or limit the doom scrolling, that will prevent dopamine crash loops and also will protect the emotional stability, and sometimes the circuit breaker, as I mentioned, is a high fiber breakfast. Sometimes it's the 3-minute diaphragmic breathing or the vagal breathing, as I mentioned, or sometimes it's just muting a toxic feed.
Can we
Each
talk
breaks
about
the loop at a different step.
each of those interventions will break the loop by just noticing what's going on, how it is impacting you, and then making intentional choices about how to limit the impact of each of those influences. And I was actually going to ask you about the algorithm. I mean, so like as you were talking about algorithmic hygiene and limiting exposure to upsetting information, I'm just going to stand in, not just for our clients, right, but also for every therapist within the sound of our voice. I mean, we're living in a universe right now where, I mean, just basic news is oftentimes filled with things that are very upsetting, challenging. I mean, we have, environmental disasters, political assassinations, shootings. I mean, global disasters, famine, like it never ends. And I hear what you say about like limit your exposure to certain things. But I guess one thing I would want to know, what do you recommend to people who, I mean, I struggle with this personally. Like, I understand that after I look through the news and learn about terrible things happening in the world, like you and I were just chatting for a second before we started recording our interview about a news story that I noticed today where the government of Afghanistan is destroying all the internet infrastructure so that the population no longer has access to the internet. I'm just like, whoa, right? But so, I mean, I get theoretically how not looking at all of that stuff all of the time is probably good for all of our mental health. But I think as a citizen, I feel like I have some responsibility to know what is going on in the world, to be able to make informed decisions. And I don't know, like we should understand. How do you talk to people about creating that balance, right? Like, yes, you need to know what's going on in the world, but no, not in a way that starts damaging your damn gut microbiome. Where do you go with that?
So the way I use is basically, we talk about sleep hygiene, we talk about your food hygiene, but we can also speak about your algorithmic hygiene. And so it's the conscious practice of shaping our digital environments. And so algorithms don't hijack our physiology. And so the story you've mentioned is a clear story. So what I would focus on is making them aware of the algorithmic influence and what practices they could do, or practical circuit breakers to foster that level of algorithmic appreciation, but also hygiene. So number one is audit the feed. I want them to, I would like to encourage them to notice what types of content spike their anger or anxiety or fear or craving or low mood. That's number one. And number two is, should you mute or unfollow? So you actively look at, so what action would work best? Removing accounts, hashtags, or resources that drive the unhealthy loops. Seeding positive content. So yes, you want to know about what's happening in Afghanistan or in the world, but you also have to know that there is also some good things happening in the world. So some people are being saved, some populations have already, but our focus tends to just be on that. But so so how can we balance your content? So we talk more about, can you follow accounts that promote balanced approaches or balanced political news or something good that is happening so that you understand the good memes and the bad. So that really, this retrains the external algorithm, by the way. So as you look into the positive content, you retrain the external algorithm. And then you set boundaries. It's fine if you want to be exposed to certain pieces of news and be keeping abreast, but you have to limit your scrolling windows. Remember, the algorithm is actually monitoring how you're behaving and how much time you're spending. So no phone use within an hour of mealtime or bedtime. Simple. That could be one approach to that. And then you could also pause, have a pause protocol. Sometimes I would encourage mindful micro pauses. Take 3 slow breaths before engaging in content that might be disturbing, or that piece of news that you might feel is going to impact you. So that the 3 slow breaths before engaging with a stressful post will buffer your vagal tone.
That's good advice.
Will bring that balance.
Yeah. And I'm also sitting here wondering how you would or if you would modify any of this to speak to the reality that we all now have a new favorite conversation partner, which is ChatGPT, and thinking about the way that that is influencing the way that people are thinking about things. I mean, I've seen some interesting and new, right, but research or exploration about how we think we're asking ChatGPT a question or being fairly neutral with what we're wondering about, but that it is shaping its responses in reaction to what we are putting into it. So where you think it is like going out to the internet and bringing you information or kind of coming up with these novel things, it's oftentimes sort of amplifying what you already think or feel or believe. And I'm curious to know if that has been an area of our exploration for you yet. Because I mean, I know it's emerging right now, but I would be very curious to hear about that impact.
Yes, I mean, it's what you feed into the system, and it amplifies what you put into it. But you can also, I won't say manipulate it, but bring that balance. So triangulate. So you order it, you give it orders, you work with it on bringing in the content that you would like to be incorporated in a particular response. And then you look at how it behaves around that content and what kind of things are being generated. Oftentimes, when I work with ChatGPT, I find a lot of sorries. Sorry, I misinterpreted this. You are right. Let's go focus on this. And then it goes on and on about what I told Chat. And I'm like, no, but you missed this study and you need to work on
you're
this.
You're fighting with ChatGPT. Like, no, you're wrong. Yes. I love it.
It's like a conversation. Yeah. It's like, I know, because I'm an expert, I know what I'm trying to get at, but people don't. And unfortunately, there's a lot of shallow aspect to it. So you just take everything at face value. You don't challenge the system. But I also want to bring a good side of it, So without AI, we're not able to even understand what goes on internally in your gut. You're talking about millions of microbes taking place. And now there's there's a big project taking place in UK, looking specifically at this. And I think it is UKRI network. So the UK launched a gut immune brain access network and then it connects data with AI and clinical insights, particularly to target mental health, dementia, and obesity. So imagine you're putting all those large data sets, understanding your entire gut immune brain access. You will not be able to understand or make sense of all this large data set without AI. But trained models of AI. That's a great point. So AI is helping us unwrap some of that, and it's helping us read the internal algorithm in as much as we are wondering about the external effect or the effect of the external algorithm.
Right. That's a fantastic point that the technology is incredibly powerful and useful. And as we're talking, it's coming up that it is, more important than ever to be thinking about your sources of information and surrounding yourself with high quality, reliable information that you can really trust. And so, for example, where would our listeners go to learn more about that study that you just talked about and keep track of what the findings are? Is there a website or an organization?
I'm putting together a resource kit. I think I will also be happy to share it with all of you. But there are a couple of resources. So the UKRI, anybody can Google UKRI and they can get more information about this specific network that the UK has launched. But also Nature Scientific Reports, the 2025 has had a couple of articles running on the gut the gut brain axis and the microbiome, but also on machine learning and how AI is already reading our kind of internal algorithm. So that's another good resource for professionals and therapists. And if you want to look into, the also scientific reports had a gut-brain axis and neuropsychiatric health recent advances too. I like a TED Talk or a TED Med Talk by John Cryan, Food for Thought, How Gut Microbiomes Change Your Mind. So this one is also a good one and a good introduction. And I believe you also shared earlier before we started recording the Brain Maker with David.
Oh, yeah.
Perlmutter.
Well, I'll show that. Well, so first, thank you so much for sharing all these links, and I will be sure to send them to me after this, and I'll be sure to add them into the show notes that go along with this episode. So people listening are like, wait, I want to learn more. Can come to the episode on my website, growingself.com. Just come to the For Therapist section. I'll be able to find it. And then I'll show you. So we were chatting about this book. I don't know, the title might be backwards, but it's called Brain Maker. The author is David Perlmutter. This is one that I read and I thought it was very interesting and does a nice deep dive. It's more to like gut microbiome and its impacts on health, but also cognition and mental health. But it cited a lot of very interesting articles and studies. And so it was a great explainer. And then, of course, sign up for my newsletter so that you can be notified when we schedule the date and time for Dr. Tatyana to come and do her trainings, which will award you a free CEU hour where you can learn more about her process, maybe some of her assessment questions and her recommendations for what to do with clients in order to support them on a holistic level above and beyond psychology that takes into consideration all the different things we've been discussing today. I'm so excited about this, by the way.
I am too. Thank you very much for the opportunity and for making it happen.
Yeah, it's going to be great. Okay, so then very lastly, in the meantime, where can people go to learn more about you and your work? And do you have consultation opportunities through your practice? Like if a therapist was going to get in touch with you for maybe assistance with nutritional support, or tell us more about that.
Yes, so I do. So I have a website. People can reach out to me at www.tatyanaelkour.com. And I do offer mentoring. So I do offer, of course, consultations for patients and clients where we look at individual consultations or practical interventions or circuit breaker coaching as well. So I do that within a group setting too. But for professionals, I like to also give a one-on-one mentoring or coaching sessions, but sometimes workshops for specifically for therapists, integrating the gut, brain, and media psychology insights into practice. And so giving them guidance around that and giving them also one-on-one care models. So, for example, what would need to change in their own practice care model, showing how therapy and nutrition can collaborate effectively, but also looking at it from a media psych lens. And I do some talks like the talk we had today. So webinars or, of course, podcasts or other keynote talks on emerging topics related to the gut-brain media interactions.
Amazing. So much good stuff. Okay. So TatyanaEl-Kour.com. And I'll be sure to link to that in the show notes to this episode as well, so that people can easily find you, learn more about your work and your training opportunities and your services, because this is really important. And it makes so much sense. We all need to be thinking about this right now. And I consider this to be such an important emerging, space, but a very important aspect of professional development for therapists to continue to evolve and expand their knowledge so that we can be truly helpful to our clients. And I just thank you so much for your work in this area. It's very cool.
Thank you very much, Dr. Lisa. It's been a pleasure. Thank you for having me.